Well, folks, we're here at ASCO GU and we bump into the infamous Dr. David Braun joining me on Healthcare Unfiltered. David, how's ASCO GU treating you?
It's been great so far. Good to see old friends and some good science.
All just by duration, not by age.
Oh, no. All young at heart.
So rumor has it you've got a paper in this magazine called Nature.
Yes, yeah, one of those typical science magazines, but
Tell us about that. Congratulations, by the way.
No, thank you very much. This is a huge team effort, and what we really want to do is a first-in-disease personalized cancer vaccine for kidney cancer. We know that lifting the brakes on the immune system, these immune checkpoint inhibitors, have helped so many patients, but there's a lot more we need to do. And so the thought is, let's try to add a steering wheel. Let's really try to steer the immune system with a cancer vaccine against neoantigens, and try to see if we can improve outcomes. And it's an early study, but I think we have some pretty promising results.
Can you tell us a bit about the study in a way that clinicians and folks who maybe don't spend their time in the lab or doing kidney cancer understand?
Absolutely. So what we did was take a group of people who had high-risk kidney cancer that was removed by surgery, but really was at a risk of coming back. Maybe a third or half of these patients would have their kidney cancer ultimately return. And we asked if we could make a personalized cancer vaccine that would target specific mutations in each individual person's cancer. And so we did that. We wanted to see if it was feasible, and it was, if it was safe, and it was. And finally, could we generate actual immune responses that were unique to those specific tumor targets, those neoantigens? And in all 9 patients, that was the case. There were good immune responses that were long-lasting, lasting months or even years. And I think, encouragingly, the 9 patients that we treated, none of them had their kidney cancer come back, but we have to now study that in much bigger trials.
What's the follow-up for these?
So for this trial, we've been following them actually for years at this point, for 3-4 years. So we have good follow-up for this group of people, but it's still small. It's only these 9 patients. And so we're partnering with larger groups now to really do this in a much more expanded way.
Maybe my last question to you before we let you go is what is next after this data that came out?
So really next is we've done the science, we've sort of shown the proof of concept. Now we have to really understand, is this going to work? Is this going to help prevent kidney cancer from coming back? And so there's a phase 2 study with Merck and Moderna, the InterPath 004 study, where we're really going to understand, is this going to decrease the risk of kidney cancer coming back?
Congratulations. Looking forward to future research. And Dr. David Braun from Yale University. Thank you.
Absolutely. Thank you.